the beautiful message of the World Malaria Report is that we managed to significantly avert that doubling in malaria deaths. So we basically made sure that every mosquito net, or nearly every mosquito net at least, that was supposed to go out in 2020 went out. We switched the distribution of something like 180 million mosquito nets from fixed points to door. That meant a massive replanning and reprogramming, and the people distributing the nets needed PPE to make sure that there was no onward transmission of COVID. And so basically what we saw was almost every mosquito net that was planned to go out in 2020 went out. At the same time, the indoor residual spraying campaigns, everything we could do to make sure they went ahead, they more or less all went ahead. And in the Sahel, where they use something called seasonal malaria chemo prevention, more than 21 million children were protected by these drugs that they get once a month during rainy season. And so actually through fantastic country leadership in Africa, at all levels, from community level, Ministry of Health, presidential level, go ahead to do these mosquito net campaigns and to maintain malaria case management. There were some disruptions to case management. You know, during lockdown, you couldn't get to a health facility because there was no transport. In some cases, we got a lot of delays in commodities coming into countries because unfortunately a lot of the commodities for malaria are not made in Africa. I think what COVID has taught us, the value of real-time data for decision making. I think the other lesson is, even the health systems in the US, in Europe have struggled with COVID. It shows the importance of investing in health. And I do hope that we will be able to keep the issue of malaria and other diseases such as malaria high on the financing agenda, because otherwise we will see more people dying from malaria in Africa than will be dying from COVID in Africa. So I think we have to invest in health, and we have to keep health and malaria high on that financing agenda and on that political agenda so that we can end malaria once and for all.